name is Y.S. PRAKASH. I'm from the Mayo Clinic in Rochester, Minnesota, in the United States. I'm an anesthesiologist. I'm also a physiologist and a biomedical engineer. Our group works on understanding lung diseases in babies, children, adults, understanding how asthma, wheezing disorders occur. And one of the things we are finding over the last 2 or 3 years is there's potentially a role for the calcium sensing receptor in the lung. So in collaboration with Professor Riccardi at Wales, Professor Jeremy Ward in England, Professor Wenhan Chang and UCSF, we have interestingly found that calcium sensing receptor might be involved in asthma. And so we had a very nice paper on that. We are now doing more experiments, more studies to understand what calcium sensing receptor might be doing to worsen asthma. And so flip-wise, what can we do to try and treat asthma by targeting the calcium sensing receptor? So one of the things that I'm going to talk about here is the potential role for calcium sensing receptor in babies, in the neonatal lung, in what happens with as the baby is born, especially a premature baby, a baby that's born before 39 weeks, that is at risk for lung disease, including asthma and bronchopulmonary dysplasia. How can calcium sensing receptor work, especially if it's so important for lung development? Is the calcium sensing receptor abnormal? Is it working abnormally? Can we target the calcium sensing receptor to try and understand how we can treat diseases of the lung, especially in babies and children? And so that's what I'm going to talk about today. Thank you.